Good morning all. Humble request for all the distinguished participants to mute their audio and not to share their screen to avoid disturbance during the session. Kindly cooperate. Any queries during the sessions can be messaged in chat box and we will bring it up all at the end of the session. In the interest of the other participants who were not able to join at present, we have around 120 participants. Plus, if some others are interested joining, kindly inform them. We are going live in our YouTube channel. That is live, we are streaming. So the link will be put in the chat box. So you can inform them. Start the session. Encourage is not having the strength to go on. It is going on when you don't have the strength. A very pleasant morning to one and all. Myself, Ms. Marlin Suja, Assistant Lecturer, RVCN, feels honored and privileged having an opportunity to be the MC for today's events. And it gives me an immense pleasure to extend a warm welcome to all the participants for the webinar on this special day celebration, that is World Population Day, on behalf of RVCN fraternity. World Population Day is an annual event observed on 11th July every year, which seeks to raise awareness of global population issues. The theme for this year, 2020, is right and choices are the answer, whether baby boom or must. The solution to shifting fertility rates lies in prioritizing the reproductive health and rights of all people. The joyful heart sees and reads the world with a sense of freedom and graciousness. We invite our greeters to spray the sweet aroma of happiness through the words of welcome. Now I call upon Mr. Ajay Gowda, Assistant Professor, Psychiatric Nursing Department, to welcome the beautiful gathering.
Thank you, Ms. Merlin. Pleasant morning, one and all. I would like to acknowledge my hearty welcome to Dr. Bhavana Mishra, Senior Obstetrician and Gynecologist at South Bengaluru for today's event. Dr. Bhavana Mishra is practicing mainly at Aster RV Hospital, JP Nagar, and Kanakpura Road in a clinic IKEA. She has a total work experience of 20 years and has worked at the forefront in the fields of obstetrics, gynecology, and infertility. She has completed a graduation in medicine and surgery and her postgraduate studies from Mysore and Bangalore, and also has extensive experience working in corporate hospitals such as Columbia Asia, Yeshwantpur, and Cloud9, Jayanagar. Our main areas of interest are high risk obstetrics, managing menstrual disorders, PCOS, recurrent miscarriage, and infertility problems. She is empathetic, attentive, and has a proactive, holistic, and personalized approach to patient care. She understands the emotional stress involved in assisted reproductive treatments and enjoys supporting her patients from conception through to birth. Her attention to detail is second to none, and she often receives referrals for complex cases. She can apply her specialist expertise to develop the best approach into treatment. She now brings her unique expertise to benefit the ladies through awareness, interaction, and collaboration through this talk today. So, on behalf of RV College of Nursing, we welcome you, Madam, wholeheartedly. Next, I would like to take this opportunity to express my warm welcome to Dr. Raksha, OBG Department, Registrar, Aster RV Hospital, Bangalore. On behalf of RV College of Nursing, we welcome you, Madam, wholeheartedly. So next, I extend my cordial welcome to Dr. S.R. Gajendra Singh, Principal, RV College of Nursing, for his enthusiastic support, encouragement, and guidance in organizing this webinar. On behalf of RVCN, we welcome you, sir, ardently. So next, I would like to take this opportunity to express my warm welcome to Dr. I. Clement, sir, HOD, R&D Department, RV College of Nursing, for taking efforts in planning and guiding us throughout this event. We welcome you, sir.
Thank you, sir.
Next, I extend my amiable welcome to all HODs of various departments, faculties, staffs of various institutions, and participants for this webinar for their presence in this event and support throughout. Lastly, my heartfelt and warm welcome to all the students for their presence amidst us and joining us for this event. Welcome you all once again. Thank you, everyone.
Thank you, sir. A lamp does not speak. It introduces itself through its light. Achievers never expose themselves, but their achievements expose them. Next, I invite Mrs. Sheila J. HOD OBG Department to deliver the inaugural address to the gathering.
Good morning, one and all. I thank the organizer for giving me the opportunity to deliver the inaugural address. World Population Day is observed every year on 11th July to remind people of the challenges being faced due to overpopulation. The day is marked to call for attention to issues like the importance of family planning, child marriage, gender equality, human rights, and others. When we look back at history, on 11 July 1987, World Population Day was put forward in public attention as the world's population surpassed the 5 billion mark. The World Population Day was commemorated and recognized by the United Nations General Assembly in 1990. Since then, the day has been observed and acknowledged every year. It took hundreds and thousands of years for the population to reach 1 billion, and then it increased sevenfold in just another 200 years or so. The world population passed the 7 billion barrier in 2011, and it now stands at approximately 7.7 billion, with an anticipated increase to around 8.5 billion in 2030, 9.7 billion in 2050, and 10.9 billion in 2100. India has the world's second largest populace after China, and in the present days of the COVID-19 pandemic, dealing with such a big population proved difficult during the second wave of the pandemic, which raised the country's fatality rate. As a result, focusing emphasis on population management, not only in the country, but also on a worldwide scale is critical. This year, the World Population Day theme focuses on the importance of reproductive health and rights of all people, that is, rights and choices are the answer, whether baby born or bust. The solution of shifting fertility rates lies in prioritizing the reproductive health and rights of all people. The pandemic has affected everyone worldwide. However, some people are more vulnerable as community-based services have been interrupted. It has also increased gender-based violence globally. While an increase in population has been seen due to unplanned pregnancies, due to the unavailability of precautionary measures, the population bust of failing fertility rates in several wealthier countries has also been reported. Hence, it has become very crucial to reproductive health. On this special day, the world comes together with the goal of highlighting the difficulties created by overpopulation. It also raises awareness about how overpopulation may harm the ecosystem and the progress or growth of humanity. Amid the COVID-19 pandemic and fear, there has been a lot of focus on creating awareness about overpopulation on a national and global level so that the world ensures a long-term growth of our existing resources. It has been very important to take proper care of our health and follow all the safety and precautionary measures to protect ourselves. Self-care interventions for sexual and reproductive health should also be prioritized, and childbirth are the essential services that should be taken care of during this crucial time. As health professionals, it's our responsibility to educate the population in order to have a better future for the coming generation. Thank you, one and all, and hope you all have a fruitful webinar ahead.
Thank you, ma'am. Believe you can, and you are halfway there. We are pleased to have in our midst the esteemed eminent speaker of the day, Dr. Bhavana Mishra.
A very good morning to all of you. Am I audible to everyone? So I would want to start this talk by thanking one and all who have got me here on this esteemed platform.
Dr. Bhavana Mishra, MBBS, DGO, DNB Senior Consultant, Obstetric and Gynecology, Aster RB Hospital, Bengaluru. It's my pleasure to wholeheartedly welcome you, ma'am, for the webinar and to take over the session. Over to you, ma'am.
Thank you so much. Thank you for having invited me. And I hope I'm audible. Merlin, could you confirm? Am I audible?
Yes, ma'am, you're audible, ma'am.
Okay, all right. So the first thing that we are concerned about today on this World Population Day is to we are one of the major contributors of this world, and my topic today deals with adolescent sexual and reproductive health. So adolescents form a major part of the population. If you talk about individuals below 25 years, then about 7.2 billion people, make up this huge population of below 20 and 25 years. And then, so without wasting much time, today has been a very busy day in other senses also. We will come to our presentation. I will just start sharing my slides and take it from here. Slide forward. First. Okay, so the topic assigned for today is concept of adolescent sexual and reproductive health, uh, problems, control, and prevention. Okay, now, before we really start this talk, let's understand who constitutes this adolescent group. So the WHO defines adolescents as individuals in the second decade of their life between 10 to 19 years. Now, more than the age being there in numerical value, it is a phase that we have to understand, a phase which sees tremendous change in one's physicality, and there is a lot of psychological changes also that happens with the changes in physicality, and a number of social responsibility also change a lot during this time. Now, coming back to what is adolescence, so this is a phase which involves transition between the childhood and your adulthood, where physical and cognitive changes prepare us for adult responsibilities. Now, there is appearance of secondary sexual characteristics, as we all know, which is also called as puberty. So this is when the puberty actually dawns on us, and then finally leads to sexual and reproductive maturity. Now, development of adult mental process and identity also happens during this period, and transition from total socioeconomic dependence to relative independence. So we know before we have attained our adolescence, it is our parents who decide everything about us, about what we will, what kind of money we should possess, how we should spend, and so in a lot of way, a lot of independence is suddenly coming to us. Plus, with the changes that is happening in our body, we also see that there's a lot of psychological changes that happen. Now, to divide your adolescence into three stages, early, middle, and late. So this slide tells us what it is. Early is 10 to 14, middle is 14 to 15, and late will be 16 to 19. So early, adolescence, we see our physical growth spurt, beginning of sexual maturity, which is characterized by, growth of sexual hair, breast budding, and our external genitals undergoing changes. And the middle is the one where, with this physical changes, we develop a stronger sense of identity. So this is the time when we are actually, become conscious of our gender, and we relate strongly to our peer group, and the thinking here becomes reflective. Some kind of the abstract kind of thinking, whereas starts in the early phase itself. And here in the second stage, we start to reflect also. And the late stage, between 16 to 19 years, body takes the adult form and has distinct identity and morely settled ideas and options. So by now we are kind of, attaining some kind of a maturity in the late stage. So, what are the factors that actually shape our adolescence? To sum it up, it all the major contributors would be the race to which we belong, our ethnicity, our socioeconomic status, our family and immediate, group in the society, our peers, and of course the religion that we follow. So what happens is, there are so many things that we will know, which is influenced by all this. We will see them in the slides to come. Now, in the next slide, yeah. So what is this who and cry about adolescence? What is it? So we know that it's a unique time in our life requiring special attention, it's characterized by physical, emotional, psychological, and developmental changes, our emerging sexuality, awareness of gender identification and sexual orientation, a time of changing new relationships with our peers, partners, parents, social relationships, expectations, roles, and responsibilities. So, this is a very, very critical time. We suddenly see that with the secondary sexual characteristics, our hormones have taken, a big control of us. Our life is suddenly at a turbojet speed. The physicality is changing, the neurological changes are so evident, thinking, maturity. So sometimes to strike a balance and to move ahead smoothly becomes a challenge. Now, so, we during this unique phase of transition, we also have unique health problems. And many adolescents move from childhood and to their adolescence and adulthood in good health. But there are, specific problems that can strike us at this phase. So, the key health problem is, that with our sexual maturity, a girl especially, she is capable of getting pregnant. Too early pregnancy is very risky to both the mother and the baby. And these kind of, people in extremes of age at a very young mother can have problems, which are very peculiar during pregnancy and during childbirth. Also, we are at a great risk, both men and women, of contracting STDs or sexually transmitted diseases. And we are all aware about HIV and hepatitis B and all that. And and there can be, there are these harmful traditional practices. That is what we saw in our last slide, that religion and family and society has a major contribution. So whatever is the traditional practices, we are kind of obliged to follow it, like say early marriage, or some kind of a sexual coercion, or force to, for a sexual relationship for whatever reason. Now, the other issues are of a different kind. People at going through this adolescence will know that they have some kind of a risky behavior that they acquire, and they start taking too much of risk, and they have a lot of challenges, and they have a lot of peer pressure. So they can be, the first and foremost, I think, is that they can be substance use problem. This is the time which can lead to a lot of addiction and habit forming. And of course, those reckless kind of behavior and risk-taking behavior can lead to injuries from accident and even intentional violence, fights, and all that. And endemic disease, of course, at all age we are vulnerable. So say in an African setup, or in a tropical thing, malaria, HIV, tuberculosis. So these things can also simultaneously affect us. And one of the very important problem at this point is around our diet and nutrition. So people we get so influenced by a lot of fad diet, and which can lead to under or over nutrition. So problems like bulimia, anorexia, or obesity, all this can hit us at this time. So, coming to the other adolescent health problems, we know that menstruation is a big challenge in a woman's life, especially when we are just kind of, going through our puberty. So, a very, very common problem here, my special interest as a gynecologist is about puberty menorrhagia. So, these girls have, a prolonged period of flow of about more than 7 to 10 days, and sometimes it does not even stop on time. There is this pelvic pain and abdominal cramps that we have all gone through. So menstruation and to deal with it and to get adjusted is a very, very big challenge. And of course, men also have their reproductive issues of teen pregnancy that we spoke about, mental health problems, and this risky behavior leads to early and unprotected sex. There can be addictive behavior, there can be accident and violence, as we spoke about, there can be sexual abuse. So whereas physically we have, we start developing our secondary sexual characteristic, but mentally we are not very mature. Taking advantage of this, there are people who are praying for such individuals, and they can face a lot of sexual abuse. And having indulged in any of these things that we know traditionally is not very approved of, we start undergoing depression and suicide. Thoughts of suicides is really, really looming large. And of course, eating disorders that I spoke about, nutritional issues, and eating habits. So these are the common problems that we have. Beside, just dealing with the period and the flow and bleeding, there is so much more to tackle. Your premenstrual stress, that is it's a big challenge to deal with. You start feeling very bloated up, there's a lot of fluid retention, you put on weight, you are so agitated mentally, and dealing with acne and unwanted hair growth can be very, very kind of depressing to the child. And beside all this, there's so much of peer pressure, bullying. People are kind of your friends. I think they call you names, they call you sissy if you have not tried something new, or you are too traditional and conventional in your thoughts. So to deal with all this, it's very, very difficult. We as parents have seen our children go through it. Plus there is another thing that the child starts having a lot of parental conflict. They have a lot of conflict with the ideas that has been told to them by their parents, and to follow it, it gets really, really difficult. Now, coming to our next slides. Okay. So this is about early and unprotected sex. Of course, it leads to, growth in population and whatever, but it is very, very scarring mentally. It is more common nowadays, I think, because of the, according to the official data that is available, and we will know why. And so this is evidenced by increase in number of unwanted pregnancies, unsafe abortions, and there is steep rise in all sexually transmitted disease, most importantly, hepatitis B and HIV. And so early and unprotected sexual experience is not planned, and with no knowledge of consequences, which can lead to a lot of social problem and embarrassment. So I remember maybe when I started my practice some about 18 to 20 years back, there were very, very few these kind of teenage people who would come to us or seek our help. But it's quite common now, and it's expected that we don't even raise an eyebrow, and we don't even try to pry about what and where and who's the partner, because it's after all their life. But later on, there's a lot of guilt and that comes with it. And of course, abortion is not easy. So many times, people think it's as easy as popping in some pills, but it really isn't, and it's very, very scarring mentally. Can also affect your future reproductive functions. Now, so what are the predisposing factors that leads to early and unprotected sex? of course, the reckless nature of adolescence itself. And plus, we are living in a society which is increasingly, sexualized, shall we say. So this may be as a result of media, which is both electronic and print. We know at the tap of your smartphone, there's so much more, knowledge that you can get about it. If I say that people, the children today are not as innocent as they would be maybe 20 years back, it won't be an understatement. Plus, the people the exodus of small village families towards the town and breakdown of the traditional family structure. So when you are in your village, amongst your relatives, there's some kind of a pressure to be this good boy or good girl. Once you've walked out, or say if you're living individually, studying, living in a hostel, then you think there's no one to watch over, and you just give in to whatever uh, you feel like, and then there's a lot of conflict, and forced migration also puts you at risk, and you're pressurized into desperate situations. Sometimes even forced sex is not very unusual, and sometimes during economic hardships also people have forcibly taken up some kind of a job like that. And then nowadays the trend is that we attain early sexual maturity, and whereas because you have to shape up your career and all that, marriages are generally late. So these are the reasons which lead to early and unprotected sex, and there is so much exposure now of all kind. You think if your friend shares some kind of a experience, then you think, okay, why not me? And this peer thing also really leads to it. Now, so how do we tackle all this, and what can we do? What should adolescent, what do they need, and why? So the first thing is, that the adolescent group should be informed, and they should develop their own. They should become skillful in a lot of ways which can support them, and they are not forced for some uh, untoward practice. And then so information of something like what we are having today. So that is very important. And then a safe and supportive environment. That is you know it is no longer a child's world. You've stepped into the adult world. Safe and supportive environment, health and counseling services, uh, and then access to some kind of a economy and decision making option also actually delays this kind of behavior, and they feel more responsible, and they uh, do not participate in something very prematurely when or they don't feel forced to do something. Now, okay. So now this is a very, very debatable topic. So whether we should be teaching our adolescents about sexuality kind of education or not. So it's still very debatable. People think that if they stay ignorant, it'll change the way most of the practices, but actually it is not so. With knowledge we feel empowered. We'll see in the subsequent slides that with this kind of education and knowledge, the risky behavior and a lot of other health problems actually start to diminish. So what does this comprise of, this kind of education? Of course, you involve young people as key decision makers in program design, in implementation and evaluation of this, and provide comprehensive, accurate information in a manner which is appropriate to their age group and sex. So, it's not that physicality itself is bad, but yeah, at the right time, with the right person is important. And that kind of a uh, probably maturity does not dawn to us so early, but we should know what it is, and that it is something very, very natural, and a feeling of guilt should not come with it. And then we should address barriers to accessing health and informative services, empower the adolescent to make life choices that are best for them, and use information services through media. So of course you know that a lot has been told on the television and thing about this, and there were we should, when you are a small child, you are taught about inappropriate touching and all that. When a school kid must come and report about all this, but when you are an adult, you know that sex education actually leads to, as we can see in this slide here, it can lead us to higher level of abstinence from such risky behavior, greater use of contraception, and the initiation of sexual activity at the right time with the right person. And these kind of people who are educated have greater use of contraception, fewer sexual partner, lesser problems in terms of sexually transmitted diseases and all that. And uh, so thus it helps to protect the young people from some of the potential risks of sexual activity if the knowledge is adequately imparted. Now the same thing is so these are the kind of stages where who play an important role in fulfilling our sexual right. In the first innermost circle, we see that our immediate family, our parents, brothers, and sisters. In the second circle are the people close by, like neighbors, friends, family, relatives, teachers, and the healthcare providers, the religious leaders, and the traditional leaders. The second most outer circle is this is a big influence, I think, according to me. The media people, the film star, the entertainers, the figure, they also kind of influence our thought to a great extent, at least about physicality and thing. You think if your favorite actress can do it, why not you? And it is just right, and we just hero worship them without really weighing the pros and cons. And of course, the biggest the outermost ring is that of politicians, journalists, and bureaucrats, who are the kind of the policy makers basically. So these are the group that influence us. Now according to the World Bank framework, so these are the lenses that we should actually be looking at. So first lens, second, and the third lens. So the first one is you have to broaden opportunities for young people to develop skills and use them productively. So they should not be forced to do something. Once you have this taste of being capable of something, then you kind of bank on your own decisions and do not and weigh every decision very, very carefully. The second lens would be to help them acquire capabilities. Like, say there must be some aspiring student who wants to become a nurse or a doctor. So to get them to study further and to qualify, that is helping them acquire the capability that they should. And the third lens is for someone who's already faltered one, to give them, to offer them a second chance, to recover from bad decision, either by which they have taken or others have taken on their behalf. So I think that brings us to the end of this thing. Now my presentation is done, but here I would want to, I think I'll put the video. Switch on the video. Yeah. So most importantly, what I want people to decide now is, from a gynecologist point of view, it is very important to know about the importance of the factors that we have to prevent getting into a lot of problems. Like the first one I would say is about vaccination. Of course, we are too involved now with our COVID vaccines, but beside this, we must understand that we have vaccines for hepatitis, which is again very important, and to know that, what are the other kind of sexually transmitted disease. When you have a few symptoms, which you may not know is that of a STD, not to ignore it, like lower abdominal pain or vaginal discharges or continuous kind of cramping, burning sensation when you are urinating. So these things could be a part of your sexually transmitted disease. So if you, or a pelvic infection, let's say, which can be very easily treated. So it is best that you bring this to the, to the knowledge of your healthcare provider or your family members and get yourself evaluated. Of course, prevention, we say, is very, very important. So getting vaccinated in the first place. Second is, if you are engaging in some kind of a sexual behavior, to use a barrier contraception. A condom, for instance, goes a long way to prevent a sexually transmitted disease. And I think with this, I would want to wind up my presentation. If there's anything that people would want to ask, probably like we discussed, could be forwarded on the chat box. Thank you so much.
Thank you, ma'am. Dear participants, do you have any queries? You can put in a chat box, or you can directly mute yourself and you can ask to the ma'am.
Hello, ma'am.
Hello, tell me.
I'm Sheila here. Good to meet you, ma'am.
Thank you. Tell me.
Ma'am, we know the importance of HPV vaccine, but that is not being very effectively taken by many of our adolescents. So can you please throw some light on it, ma'am?
Yeah, so there are two kind of HPV vaccine. The first to let people know that HPV vaccine is a major cause for cervical cancer vaccine. This is one cancer which is caused by a virus. That is what it means. Say if this coronavirus, we know what are the problems that it can cause in an individual. Similarly, there is this cancer which can be very easily preventable if you get vaccinated against this HPV. So it is available in two forms. The brand names I will tell you, one is Cervarix and the other one is Gardasil. Basically, one is quadrivalent, that is against 4 serotypes of HPV, and wherein Cervarix is bivalent against 2 most important cancer-causing HPV strain, which is number 16 and 18. So this is received, you can get it from as early as about 13, 14 years to 20, 21 years. That's the best time before you are exposed sexually to take it. It's given as 2 shots of intramuscular injection, 1 month apart. So the Gardasil one, only 2 you need. For Cervarix, you need 3, which is at 0, 1, and 6 months. So it is pretty, cost effective. Also, if you think all the 3 shots put together cost you somewhere around 5,000 rupees, and easily available. We have done a lot of, awareness programs around it, because cancer cervix is one thing, as you may all be knowing, that from the point of, when it is limited inside the cervix, for it to start spreading onto form a frank cancer, it takes about 10 years. So vaccinations and regular pap smears goes a long way, and we can always pick it up at a very early stage, wherein we don't even have to remove the cervix, or even there are smaller surgical procedure to deal with it. So that is about the cervical cancer vaccine. Everyone, all of you who have teenage daughters, or even the Gardasil one can also be used for men, for young boys. So to get your children and get them vaccinated. Beside these things, the Gardasil one will also prevent anal cancer and penile cancer to a large extent. I hope that answers your question.
Yeah, thank you, ma'am. Ma'am, you said the right age would be 13 to 20.
See, in our Indian setup, generally, if you unless it is very, very, different. Mostly people start getting aware about their, the sexual thing, or you have a probability of a sexual contact maybe around after 16. So even, 16 would be okay for a girl who's not had a sexual contact and who's not married at any age could take it. There is no harm taking it. Say you're 24, not sexually exposed, but getting into marriage, you can still go ahead and take it.
So is it okay to get it vaccinated after 20 years?
Definitely, definitely. See a housewife who's already married, maybe has a children. Is she a good candidate? You can ask me. So there's the first thing that we should know is that during pregnancy and during feeding, one should not take it. But even if you have been infected, we don't know through which serotype. So besides 16 and 18 and a few more, others cause just some kind of a genital wart and all that. So she can still take that vaccine. It will be of some use to her. It can still protect her from the cancer causing kind of virus. Okay.
Thank you, ma'am.
Okay. Anything else?
Any queries, participants? Okay. Okay. Thank you so much, ma'am, for an
Thank you.
enlightening on sexual and reproductive health among girls and women. It was an informative and valuable message for all of us. We are very grateful to you, ma'am, for having consented to be the resource person for the day and spread your valuable time to be with us on this occasion.
The pleasure was all mine. Thank you all. Thank you all for a patient listening. Thank you so much.
Gratitude is not only the greatest of virtues, but the parent of all others. Now I request Ms. Shalini Chowdhury, Assistant Lecturer, to set the food to propose vote of thanks.
Thank you, ma'am. Gratitude is the fairest blossom which springs from the soul. A very good afternoon to one and all. At the outset, I deem it privileged to propose vote of thanks. I wholeheartedly thank the renowned speaker of the day, Dr. Bhavna Mishra, Senior Consultant OBG, Aster RV Hospital, Jayanagar, for sharing their valuable knowledge and experience with our delegates. Thank you, ma'am. It's my utmost privilege to give thanks to Dr. Raksha, OBG Department Registrar, Aster RB Hospital, for joining us today for the webinar. Thank you, ma'am. I also thank Dr. Nazim, OBG Coordinator, Aster RB Hospital, and special thanks to marketing team, Aster RB Hospital, for coordinating with us for the webinar. Thank you all. I extend my cordial gratitude to Dr. S.R. Gajendra Singh, Principal RVCN, for his support, encouragement, and guidance in organizing the webinar. Thank you, sir. I extend my heartfelt gratitude to Dr. I. Clement, sir, HOD Research and Development Department, for the support throughout. Thank you, sir. Also, my heartfelt thanks goes to all teaching and non-teaching staffs for their cooperation and support in organizing this program. I must acknowledge deep sense of appreciation to all the students and delegates who participated and spent their valuable time with us. Thank you all. To conclude, I thank everyone for being with us throughout the program. Thank you and have a great day.
Dear participants, we will be sharing the feedback form link. So you can fill it out and you will be getting an e-certificate. The feedback link will be active for 30 minutes. Kindly participants fill it. Thank you, one and all. Have a good day. Ms. Misha, ma'am, there is no pre-test or post-test for this webinar, ma'am. Thank you.